Joining us now on the Megacast is the Chief Medical Director for the Oakland County Health Division, Dr. Russell Faust, with us on the Megacast. Dr. Faust, thanks for being with us again.
My pleasure. Good morning. Nice to see you again.
Good to see you as well. Appreciate having you on. So we usually will be talking about COVID-19. There's plenty of other issues to talk about, but before we do that, let's get an update on where we stand with COVID-19 in the state of Michigan, but in particular in Oakland County. The last time we spoke, we were talking about the BA.5 subvariant and its ability to kind of bounce around the vaccine and around some of the booster shots, at least at that time. As far as where we're at right now, what in terms of further booster shots are being developed that may be able to better combat the BA.5 subvariant, if any?
Well, I can only really speculate. CDC and FDA are being pretty closed about details. We know that the pharmaceutical companies are currently developing boosters for BA.4, BA.5. We are being told through MDHHS, Michigan Department of Health and Human Services, that we should be pre-ordering those boosters shortly, so in September. But we really still don't have a timeline, and we really still don't have a notion of whether those will be strictly boosters or new vaccines. On that topic, I do get regular questions from people who are eligible for a booster or their second booster, asking me whether they should just wait for this BA.4, BA.5 variant booster coming up, hoping that that will be all they need. And the fact is, immunity response from the existing vaccine and existing boosters are still helpful in preventing severe infection and complications from the Omicron BA.4, BA.5 variants. So the fact is, if you're eligible to get boosters, you should absolutely do it now while you can. Maximize your immune response to prevent those severe complications, and then get the new BA.5 booster when it becomes available.
Dr. Faust, the last time we spoke, we brought up the topic of monkeypox, and at the time, it wasn't really much of a large concern for Oakland County in specific, or even for the state of Michigan. Since then, cases did pop up in Michigan, beginning in Oakland County with the first recorded case in the state of Michigan. And Oakland County, in fact, later on, just a few weeks later, had created a new task force specifically to combat monkeypox in Oakland County. Can you give us a status report on where the monkeypox task force has gone, what work has been done in that group in terms of reacting to the spread of monkeypox across the globe, and in particular, how it affects Oakland County?
Great questions. Let me just quickly review the data on monkeypox. There are more than 43,000 cases globally at this time, 15,433 as of this morning in the United States, 138 cases across Michigan, and 23 cases here in Oakland County. You are correct. The first confirmed case in Michigan was in Oakland County. I hate to say it's not a concern. It's a concern in certain populations. The fact is, monkeypox virus is spreading mostly through close, intimate contact with someone who has monkeypox. You can take steps to prevent getting monkeypox by avoiding close skin-to-skin contact with the monkeypox rash, washing your hands often, especially after contact with someone who's sick. Now, following the recommended prevention steps, getting vaccinated if you are exposed to monkeypox, or if you are in a higher risk group to be exposed to monkeypox, can help protect you, your family, your community. Let's talk about, go ahead.
So when the monkeypox task force was initially formed, they did talk about vaccines. The difference between this situation with monkeypox versus COVID-19 is COVID-19 is a novel virus. We've known about monkeypox. There are vaccines available for monkeypox, but the issue had been at the time of the forming of the task force that there wasn't enough vaccine for any sort of widespread distribution in Oakland County or even in the state of Michigan.
Let's talk about why that is.
Sure,
the fact is, the monkeypox belongs to the whole family of viruses that include smallpox, the variola virus. Okay, it is not smallpox. It is not chickenpox, but it is related to smallpox. We have never had a monkeypox issue in the United States. In fact, of those 43,000 cases globally, those are across 95 countries. 88 of which have never had monkeypox. So this is a new mutation. Fortunately, it's a DNA virus. It does not mutate as rapidly as, for example, influenza or COVID-19. But because it is related to smallpox, the vaccine was originally devised against smallpox. That means in the United States, it's part of the national strategic stockpile intended primarily for our military, who would potentially be exposed to a smallpox potential bioweapon. So we're having to draw nationally, we're having to draw on those strategic stockpiles for a traditionally created, developed vaccine to vaccinate the communities that are at risk. So unlike the mRNA vaccines, this is one of the advantages of the COVID-19 vaccine. It's an mRNA vaccine. It's basically rapid and inexpensive to develop. And as they make the new BA4, BA5 variant, they take out the cartridge for the original and insert the sequence for the new spike protein variants. That's not possible. So to ramp up production of this monkeypox or smallpox vaccine, Jynneos, is going to take a while. So that is happening right now. One of the ways to stretch our sources of monkeypox vaccine is to, instead of injecting it subcutaneous, we're injecting it, according to CDC and MDHHS, intradermally. And the intradermal means there's not a great blood supply there. So the injection lasts longer, gives it a longer chance of our immune cells to ramp up a response. There are a lot of immune cells in your skin, and we're able to stretch it five-fold. So instead of half a milliliter, it's 0.1 milliliter per intradermal injection. So that's what's happening now. We're also being promised, and we continue to receive allocations of the smallpox or monkeypox vaccine. With regard to the, well, that's gone. Go ahead.
In terms of availability for those that are at risk or are in higher risk groups for contracting monkeypox, what is that availability in Oakland County? Who is eligible at this time for vaccination?
So basically, number one are those who are exposed. And there are people who, as we do contact investigations, case investigations, and contact tracing, those who have been exposed are eligible to start the two injection series for the monkeypox vaccine. The task force has identified a number of clinics in our county, a couple that regularly are seeing the majority of people who have had exposures. And there have been exposures outside of the state, which complicates kind of the case investigation and contact tracing, of course. They're long distance calls. Many of those contacts are not only direct skin to skin, but potentially clothing, towels, for example, that someone with the monkeypox has used, that are used by someone else around the pool party, that kind of thing. So those contacts are potentially anonymous and makes it extremely challenging to do the contact tracing and advise those folks on getting vaccinated. But we are supplying vaccine right now. I wish I had a number to give you. I do not on the numbers that have been vaccinated in Oakland County, but we're doing well at controlling this here.
We're joined by Dr. Russell Faust. He's the medical director with the Oakland County Health Division, joining us on today's Megacast. More information can be found on oakgov.com. That's oakgov.com for more information from the Oakland County Health Division on monkeypox, on COVID-19, and more. Dr. Faust, also what's been making news nationally has been a sort of resurgence, especially in comparison to numbers from past several decades, of polio nationwide. Primarily, it started popping up over the last few months in New York City, in that general area. But Michigan recently, the reports have said that Michigan is on quote unquote high alert for this, as the primary childhood vaccine series, the vaccination rate fell by 6.9% down to 67.1% statewide. How much of a concern is there with those rates continuing to drop of people getting their children the primary childhood vaccine series, which includes polio, measles, tetanus, whooping cough, hepatitis, and pneumonia, that this could spread some of these viruses and these other illnesses that had previously, if not been eradicated, had been very, very rare among children in particular?
Yeah, I appreciate that. We're very sensitive to this issue. Let's talk a little bit about polio and the history of it. I'm old enough to have been vaccinated for polio just after that vaccine was developed or invented by Jonas Salk, 1955. Thanks to a successful vaccination program, most people in the US are protected from polio. However, people who are not vaccinated or who haven't received all the recommended doses can be at risk. We have eliminated polio in the United States, and we did so back in the late 70s. That doesn't mean polio can't come in from other countries that are not fully vaccinated. So we eradicated it here in the United States, North America, and this is what occurred in New York. Now, we use an inactivated polio virus for our vaccine here for polio. Inactivated. There are reasons that that's difficult to use around the world. Things like refrigeration and transportation. So there's an oral polio virus that is used that is not inactivated. It's a live mutated virus. And if someone who's completely unvaccinated is exposed to someone who has received that oral polio virus, they can potentially become infected with polio. Now, here's the worry, the scary aspect of this. Before our vaccines were developed in the 50s, at least 15,000 people annually were paralyzed from becoming infected with polio. That's about a 1% paralysis rate. And I remember those people, walking with crutches or being in the so-called iron lung before we had ventilators. We don't want to go back there. The challenge we're facing right now is that because of some backlash against the COVID-19 vaccines, and because we've had shutdowns and reduced ease of access to, say, pediatric offices, our vaccination rate has really plummeted, and specifically in certain pockets of our community. That reduction of 7% to 60 whatever percent, that's an average, a general statistic. But there are pockets in our community, they're essentially unvaccinated for polio. And this is a concern. The patient that appeared with polio in New York was in Rockland. And there is an interesting connection between Rockland, New York, in Oakland County. And that connection is based on our previous measles outbreak of 2 or 3 years ago. And so we are sensitive and alert and monitoring right now and doing the best we can to possibly get everybody vaccinated, not only against polio, but for all the other infections that have seen reduced vaccination over the last 2 years.
Again, that metric, 6.9% down since July of 2019 as of June of this year, in terms of numbers in Michigan for those that have received the primary childhood vaccine series. We're joined by Dr. Russell Faust on the Megacast. Dr. Faust, just another couple minutes with you before we'll need to say goodbye today. Any other information at this time from the Oakland County Health Division that they would like residents to be keeping in mind or keep aware of as we go into the future?
Folks still have access to COVID test kits. And in fact, that access, that eligibility has been expanding. I know early on, there were many zip codes that just were not eligible. I urge folks to go to accesscovidtest.org and put in their zip code, see whether they can get free COVID tests. I think it's a great thing to do. I urge people to get vaccinated, get your vaccinations up to date. Do not risk you or your family to become infected with polio or any of the other debilitating diseases. And that includes influenza. So get your flu shot. Co-infection with COVID and influenza increases your fatality risk by more than 6-fold over your infection with either one of those alone. Thanks so much, Tyler.
oakgov.com/health for more information from the Oakland County Health Division. Appreciate it, Dr. Faust.
Thank you.